Okay.
All
The floor
right.
is yours.
My name's Pam Esser, and I'm Executive Director of the Attention Deficit Disorders Association. We have online virtual support groups, at least 4 a month. And then we join Ron and this lovely group once a month. And additionally, we have workshops throughout the year. I'm going to drop in one we have. We're excited. We have Dr. Ari Tuckman, an internationally known speaker who's going to be doing romance and ADHD. So it's a great gift for your Valentine to get things squared away. So happy to be here and looking forward to it. Thank you.
Thanks, Pam. Julie's calling Julie right now. Just so everyone knows, we team up with Fusion Academy, ADA, and then the Hub. It looks like Julie's back. Julie, do you want to go ahead and do your introduction?
Sure. And I just spoke to someone at Fusion Academy, and they said that Julie Garcia just sent the link out again.
Okay, great.
So hopefully more people will pop on. But hi, everybody. I'm Julie Pomerantz. I'm with the Hub Houston. And the Hub stands for Heard, Understood, Believed in. Excuse me. And we have several different campuses and programs. First of all, we have a school for ages 13 to 18. And then we have our Life 101 campus, which is a young adult campus, 18 and over. It's an employability program. All of our programs, by the way, are for those who are on the autism spectrum, as well as ADHD, maybe some medical issues, depression, anxiety, etc. We also have a social club for 18 and over called Club Hub, which meets 3 nights a week and 1 weekend day a month. And finally, we have Aspire Accessories, which is another employment program for those 18 years old and over. We refer to them as artisans, and they create magnificent items that are sold online and at markets. And so those are all the programs we offer, and I'm happy to be here today. Thank you so much.
Thanks, Julie. Yes, we are so glad to have everyone today. We will be recording this and we will be putting it on the Houston Neuroscience Brain Center YouTube channel. So if you want to recap some things, you can watch it there, share it with any friends or colleagues that you think might be interested. I'm Alexandra Roark. I'm the assistant director here at the Brain Center, and this is Dr. Ron Swatzyna. And here at the Brain Center, we use EEGs to help look for the root cause for symptoms. So this neurology report can look for patterns that can account for anxiety, depression, ADHD, trauma, brain injury, all kinds of stuff. And then we use those reports to develop a treatment plan, which can include neurofeedback therapy, red light therapy for the brain, talk therapy, EMDR, and so forth. And we see any ages from about 4 to any age can come and do an EEG. So it's really exciting what we do here, and this will, as you will see as we learn about beta spindles, I will just ask that everyone mute their Zoom accounts, and we will have a Q&A at the end. We love having conversations with you. So if you have any questions, you can feel free to put them in the chat box throughout and we'll get to them. Or if you just want to speak up at the end, we can do that too. But with that being said, we can go ahead and get started. Oh, wait, actually, I want to talk about our next discussions with Dr. Ron real quick here at the beginning. So our next one is going to be Wednesday, February the 21st from 12 to 1 p.m. Central Time. And this is going to be an interesting topic. It is going to be titled, Insanity is Doing the Same Thing Over and Over Again and Expecting Different Results. And that's a quote from Albert Einstein. Psychotherapy promotes behavioral change. So we're going to be talking about the benefits of psychotherapy and how you can add that on to other therapies to benefit your life. But now moving on to beta spindles, what are they? So Dr. Ron, what are we talking about today?
Well, beta spindles, according to the literature that we've had over the past 50, 60, 70 years, beta spindles are referred to officially as spindling excessive beta. You'll hear them called by both. The official name is spindling excessive beta. And this is a brain pattern that we see in in our current study that we just published on 1,233 patients, we found a prevalence rates overall, children, adolescents, and adults at about 31.5 now percent prevalence rate. Now, when we look at this population of children, adolescents, and adults, children have have more beta spindles than adolescents, but the adults have the greatest amount of beta spindles. We still don't understand why there's a difference in adolescence. We know that the females have less incidence of it, so there's something to do with the hormone surge, but we're still investigating that. The first time it was published was 1950 by Fred Gibbs and his wife. He's one of the ones that wrote the EEG textbooks. The second time was 1962 when he followed up that study and linked it to benzodiazepine or barbiturate abuse. The third was written in 2015. The fourth was in 2021, and we're working on the fifth right now. Our office is. So I'm on number 3 and number 4 and working on number 5. So I guess we're one of the leading world's authorities on these spindling excessive beta. So we started working with this back in, oh gosh, I guess it was first published. The first article I read was 2005 when Jay Gunkelman, one of our icons, actually called it a EEG phenotype. And I thought this was really interesting phenotype. And he talked about how this excessive beta was often would respond terribly to medications because it's a highly anxious type activity in the brain. It causes anxiety. It's closely tuned with panic attacks. If you've ever known anybody with panic attacks, and it kind of progressed throughout the years. You know, we're really trying to figure it out more and more, but I think we've got a different idea right now. And this next point I see on our little list here is about the connection with neuroinflammation. Now, we think it's associated with neuroinflammation for several reasons. Number one, it's highly prevalent. We do reports right now for several, probably 30 centers throughout the country. Well, one of our centers does only personal injury, head injury cases, and their prevalence rate is almost 80%. Ours is 31. We're not a head injury center. We do a lot of head injury work now, but when this archive was sealed, was 2019, it wasn't our main focus. So head injuries, we know, causes an inflammatory response. What can cause neuroinflammation? COVID brain, brain fog can cause neuroinflammatory issues. So people who complain after they've had long COVID and they've got brain fog, we find that we know that in the literature it's linked to neuroinflammation. Psychological trauma, physical trauma, extremes of heat, cold, or pain can cause neuroinflammation. And the funny thing is, it doesn't go away on its own. So next. What?
Yes. Okay, so there you're talking about how in the population that you see, it's about 31%. That's
Right.
pretty significant. And then with brain injury, it's reported to be more around like in the 80s.
Correct.
So that is a pretty prevalent increase. So do you think that it increased after COVID, like the amount of beta spindles that you've seen?
Well, yes, that was one of the things that triggered us into this, is that the current amount of cases that we see now, and we see a lot of cases coming in because they've got COVID brain fog. They all have these spindling excessive beta. Part of the symptomology is that it really disrupts your sleep. Not so much sleep onset, but getting up in the middle of the night and not being able to go back to sleep.
Okay, yeah. So going back to the symptoms, because if people's brains like work like mine, if I hear this, I'm like, oh my word, am I going to be a person who has beta spindles? What are some things that would be going on that would tell me that I might have this biomarker? And so you're saying sleep
Issues, panic attacks, ADHD symptoms. It's actually, there's a lot of focus and attention issues, but it's now which came first, the chicken or the egg? The sleep disruptions following this inflammation in the brain. And if a person's not getting adequate sleep, they're going to have issues with focus and attention. And so that's the main symptoms that we see so far, except we call it easily angered by small provocation. If you trigger real easily, it's like your brain's on fire getting ready to light off.
Yeah. And then with the sleep, if I remember correctly, it's just if you're waking up in the middle of the night, is that more of the sleep disturbances you would see? Okay.
Yeah, your brain wakes up and it just won't shut up,
Mhm.
that kind of stuff.
Gotcha. And then what I've heard you say before too is that this is a very energy consuming brainwave. Could you speak more to that?
Yes, let me see if we can switch over to share screen. I've got some pictures, kind of show you guys what it's like. Let me find my study here, or go to switch share screen. Okay, we get out some of this other. I should have had you do this in the first place. Right there. Okay. Now, and this is in our current study that we published. I just put it up there because it's easy to bring out. These are the F1s, the smaller beta spindles, the little tiny ones. These are the large F2s. Fred Gibbs decided to name them after himself, kind of hilarious. And this is an EEG. If you look at the EEG, the top of the brain, the left hand side of the brain in this montage, this is how neurologists look at it, is on the left. I mean, it's on the top, the left-hand side of the brain, the center, and then the right-hand side of the brain. It's called a double banana montage. Now, let's compare it with one that's a little more, no, right there. Okay, I don't have that one on this one. That's head injury. But these are the beta spindles here. And you can see how high the amplitude is. This is normal back here in the back part of the brain. They usually are always central and anterior, not necessarily all the time, but we do see them like that. But they suck the energy out of the brain. They're really energy draining. So you people that have this type of pattern, it's not just from sleeping poorly, but it is that they're expending so much energy and actually trying to produce this type of activity.
So that's the group of the symptoms. So let's say, someone comes in, they do an EEG, they find out they have beta spindles. What would be the next step? How do you treat this?
Well, interesting. Let's go back to how we made this leap between spindling excessive beta and neuroinflammation, because the connection between what it responds to everything that we use to treat neuroinflammation in medicine treats beta spindles. Kind of unique. And so what we're finding that treats it, and it's in the literature out there, are photobiomodulation. You want to explain photobiomodulation?
So photobiomodulation, we have devices here at the center that specifically target the mitochondria in the brain cells. So we put the diodes on the brain and it's able to go through the skull. And what it does is it stimulates the mitochondria to release the ATP in the cell. So it gives the brain cells more energy, more power. It helps improve their health, increases the nitric oxide, which will reduce neuroinflammation. And so this is a way that we can see really great results in our clients through treating the brain that way, giving it more oxygen.
The other way of treating it is hyperbaric oxygen. And I published an article on this, hyperbaric oxygen therapy. We have a chamber and it's on loan right now for a research project we're doing on pain and mild cognitive impairment with a neurologist. But hyperbaric oxygen increases the partial pressure of oxygen, the push into the lungs, by breathing 100% oxygen at some depth, 1 atmosphere, 2 atmospheres, 33 feet or 66 feet. And so when you push more oxygen into the brain, you increase microcapillary blood flow, you increase the healing. And so that's why they use hyperbaric oxygen in wound healing, decompression sickness, and many things like this, because it promotes healing. And so hyperbaric oxygen does reduce spindling excessive beta, and it does reduce neuroinflammation.
Okay. So we have the red light therapy for the brain, the oxygen therapy, neurofeedback.
Neurofeedback
That would be
neurofeedback by its nature is a process that we, right where we place the electrodes, it encourages more blood flow, a little bit more blood flow through a process called neutral positive perfusion that actually allows the brain to make more capillaries. We bring in more perfusion, more blood flow, you reduce inflammation. You bring in something to heal it. So inflammation, as we know, inflammation sticks around for a while. I've had carpal tunnel syndrome. This is still inflamed 2 years later. Why is it still inflamed? It doesn't make any sense. It's already healed. So I know rheumatology is suffering right now trying to find out how to treat all sorts of inflammatory issues. And they're not doing very well with it. And they'll admit it, from the normal medicine to the biologic infusions to everything else. They're just having a tough time with a lot of inflammatory issues. So it's one of the things that we know is causing us problems out there. When we discovered that this may be not just a wiring issue, as in a brain injury, but an inflammatory issue that we have to address as well. I remember Dr. Melissa Jones here in Katy. She had a quote for us, and she talked about mold, for instance. A toxin can cause neuroinflammatory response. And so what she said is, first, we have to have a good diagnosis of what's causing their issues. Second, we've got to remove the toxins. Third, you got to treat the neuroinflammation. And fourth, you got to rewire the brain with neurofeedback. Doing one without the other is just going to get a partial resolution to what you're trying to treat. So I think that's a good way to look at it. There's two components. When a brain has been stressed too much for whatever reason, got to treat the inflammation, and then you got to look at rewiring the brain. So that's how we look at it here. It's one of these things that I think has not been looked at, especially in regard to brain injury.
So it sounds like there's a lot of different therapies that can treat it. Is there any medication that can treat?
Well, yes, back in 2009, the old medication called guanfacine was repackaged and submitted as an ADHD medication for a child. And it's under the brand name Intunib. And I went to the coming out of this medication when drug reps used to have drug rep dinners that were really kind of nice, eat and drink and enjoy a nice conversation with a bunch of docs, but they would do the presentation. So this medical doctor got up there, psychiatrist, and did a presentation on this new alpha-2 agonist, which wasn't a new alpha-2 agonist. It was the old guanfacine that was not a very good blood pressure medication for adults. And so this blood pressure medication, they say, will work to help a certain subset of children with ADHD that may not respond to stimulants. Great medication. We started using it at our center at the time, and we found that it did help in regard. At least it didn't make beta spindles work worse. I mean, become worse, but it did help resolve it when we were doing it with the neurofeedback. And so this old pediatrician stood up at this meeting and he said, I don't understand. How can you get from a blood pressure medication indication in an adult to an ADHD medication for a child? And so the medical doctor came out with all this chemistry and everything else. And he said, you don't understand my question. I got to understand the logic behind a blood pressure medication becoming an ADHD medication for a child. And she said, well, we'll talk to our medical director and try to get an answer for that. And at the time, I'm usually the only Ph.D. at any of the meetings, so because I deal with medicines. But I said, I think I might have a thought on that. So she said, please. And so I said, if we consider for the longest time ADHD is a problem with poor blood flow to the frontal lobe, poor perfusion to the frontal lobes of children and adolescents, then if we have poor blood flow and we understand Boyle's law, which is the inverse relationship between pressure and volume, if you have poor blood flow, poor perfusion, you have less volume, which is higher pressure. So if you put a blood pressure medication on and it vasodilates, it will bring in more blood flow, more perfusion, less pressure. And I think that's why it works. And he said, good answer. I said, I don't have a clue if that's what they were thinking, but that logic seems to still hold true. In December 2022, I was vindicated. They did a study and they found that in COVID brain fog, the one treatment for the neuroinflammation was guanfacine plus NAC. And I've got the paper if anybody wants that. So it is something that I understand the mechanism of action. It makes sense. And so it's trying to promote healing.
Wow. Well, that's really exciting that there's so many different options to
There
treat
are.
this. So you got options. So speaking about all this, I know you mentioned Dr. Melissa Jones for a little bit, but what are neurologists saying about this biomarker?
Well, the interesting thing is they'll call it an excess of 18 to 22 hertz beta activity, but they don't know what to do with it. Again, I see a lot of medical doctors, not just neurologists, but in general, they don't read the research, so they're not up on the papers that we wrote in 2015 or 2021. They don't, and most of them were not even born before 1950 or 62. So again, they probably didn't go back in the archives and read about this because there was not much known about it. So mainstream neurology doesn't know about this. That's why I'm so proud to publish this paper and get it out there into modern. We're published in Clinical EEG and Neuroscience, which is got a pretty good impact factor, and it is listed in indexed in the National Institute of Health's archives. So
yeah, so with that being said, it's like if someone goes to a hospital and gets an EEG, they're really not going to find out if they have these because the neurologists aren't really going to point it out. They
Right.
have to go to, I guess I know we do it here. Do you have any suggestions?
Electroencephalography, neurologists that are board certified in electroencephalography or epileptology may have some insight into it. Our job, that's why I'd love to be a clinical researcher, is because our job is to get this word out in medical journals. We've got to get it out there in front of the people and identify it. And because the most important thing in psychiatry, any medication that increases beta activity would make this activity worse. So you got all these. First, what would you prescribe if you were a medical doctor? What would you prescribe for anxiety? An SSRI. That's everybody knows that. You're anxious, they're going to go stick you on a Prozac or Lexapro or something like this. However, the research has shown that when they have spilling, when spilling excessive beta exists, SSRIs increase beta, which makes them worse, has a lot of side effects. So here you are going in for anxiety, and they've already made you worse with the SSRI, and then what are they going to put on? They're going to put on, to get you some rest, they're going to have to put on a benzodiazepine like a Xanax. Worst thing in the world on top of that, because Xanax creates low frequency spindling excessive beta when it gets to the toxic level. So it's counterintuitive to their prescribing methods based upon symptoms to prescribe this. Most every medication does increase beta except for the antipsychotics. And the antipsychotics have all sorts of side effects that are really unwanted, and they're really kind of tough. I wish we had a better way to do that. So I hope that's not our screen. This concept about this, all medications like stimulants increase beta. They're going to be tired because they're not getting their sleep. They're going in for ADHD symptoms. Doctor looks at them, says, here's a stimulant for you. That increases beta a lot. And they'll have people really almost coming out of their skin, because what do stimulants do? They mess with your sleep on top of a person who already has a sleep issue. So that's why we really need to identify them, because if we can identify them, we can at least know what medications probably should be avoided, and then what other types of treatment or medication, guanfacine, could possibly be considered. And no psychiatrist has an issue with prescribing guanfacine because it's no blood pressure medicine. That really doesn't have a lot of bad side effects to it.
I mean, this is really huge. I mean, beta spindles are that prevalent in the population, causing those kind of symptoms. A good majority of that population is probably put on that type of med that's only making it worse. And so that is why we typically see a lot of people who are on so many meds and they're kind of at their wits' end. So they come and they find us, and then we can do this EEG and really help work with this. I help tailor the medications when we work with the psychiatrist. So this is important information.
Well, that's why we want to get the word out too, because we've got a small group here, but this is going to be going out to everybody registered, so they'll be able to see it anyway and pass it on. If you've got friends, family who have been through some sort of trauma or some sort of illness or some sort of brain injury or concussion or anything like that, and on the other side, they have difficulty with sleeping, they're becoming very snappish over small things, and their focus has gone down because they're not sleeping worth a darn, that would be the perfect case to send into us, or make the referral, because it's better to fix the problem than it is to treat the symptom. Obviously, in this case, it's really important not to treat the symptom.
Yeah, I mean, I can't remember if we mentioned this earlier, but how psychological trauma can create these as well. I remember someone who came in and had done an EEG with you, didn't have beta spindles, but then in the second one, they did, and with conversation with them, they were saying that they were experiencing more, psychological stressors that could have factored that in. I mean, it's hard to say, but I just wanted to throw that out there as well, that the psychological trauma can.
People who have, we see a lot of people now that have brain injuries from accidents, but they have post-traumatic stress disorder. So you got a double whammy of spindling excessive beta now that I think is really contributing to a lot of the symptomology. And it's hard to heal when something's inflamed.
Yeah.
So that's why I say, my brother just called last night. It's kind of interesting. And they're in northern Mississippi and raining like crazy right now. Hadn't seen the sunshine. It snowed for all last week, so they haven't been in the sun for a while. And he's ill as can be, can't sleep and everything else. And so I said, well, I looked up on the internet, I looked up on Amazon and got him a full spectrum sun lamp. And with full spectrum sun lamp has the 810 nanometers that near infrared does, a lot cheaper.
Yeah.
I said, and it has one of these things you can put over your easy chair to shine right on his head. I said, you would do really well if you could get out in the sunshine, but obviously you're not going to have sun for the next few days either. So it's something you could do.
Yeah.
Sunlight, I really think, why do we have such an increase of inflammatory issues all over our bodies, all over our country, all over the world that is not being effectively treated? So what my hypothesis is that, you know, we have become inside creatures. In the past 150 years, we've migrated. And so now most of our time is spent inside, where prior to people would be outside quite a bit. And it takes 14 generations, according to Darwin, in order to adapt to a new environment. And we have been 14 generations since we've moved inside. What are we seeing? A lot of excess problems now with kids, anxiety and depression over vitamin D deficiency. I think that the whole thing's linked together. You know, a lot, almost everybody's vitamin D deficient right now. And so that's why, yeah, it's incredible. And I'm sorry, you can't treat anxiety and depression caused by a deficit of sunshine with in vitamin D with an SSRI. It just won't work. So my simple first thing, get out in the sunshine as much as you can. You know, again, 20, 30 minutes without sunscreen, without a hat is still not going to give you skin cancer. But I tell you, your state of your brain and your sleep and your quality, get out there, do a brisk walk. I think a healthy lifestyle would cure a lot of these things.
Yeah. Starting your morning with 15 to 30 minutes of walking outside in the sun would be one of the best things that you can do for your brain. You know, don't start your day on your phone, scrolling through TikTok. Start it walking in the sun. What was that story you were telling me yesterday about the hospital being outside and they recovered quicker than the ones
on the islands that used to be set up for tuberculosis or for leprosy? Those that had outside patios outside of the rooms where they could get in the sun had far better outcomes than those that did have any access to the sun. So again, what has changed? I think the whole world was set together for millions of years to have everything we needed to return to a state of health after injury or illness. We've lost the sun, and I think that's really sad. You know, our children are inside creatures totally, and the more we get stuck into the screens and everything else, the worse health we're seeing.
Yeah, unfortunately. Well, I guess that's about it for our questions. So we do want to open it up to everyone. I already see that we have one popped up in the chat from JC. Are there particular sites or eyes closed, eyes open conditions you would most likely see the spindling excessive beta?
Just let you guys know, JC's a fellow practitioner in our industry, so she's got some background in this, and she wants a head start on this. But yes, we see them in both eyes open and eyes closed. Traditionally, they were found frontally and centrally, FCCC's area, but I've seen them all over the brain, and I think I see them all over the brain more so just because they end up traumatic brain injuries are mostly in the temporal lobes and the anterior part of the brain. It's smooth everywhere else, so that's where they're going to pop up where the injury sites were. We haven't confirmed this yet, but I'm working on that now. Any other questions?
Exciting developments.
I have a question. With the photobiomodulation, that's the V light, correct?
Yes.
Which light would be able to treat this? Because I believe it has two settings.
Yeah, both would be able to treat. The red light therapy itself is going to be the mechanism that treats it, but the frequencies are going to be something that you can individualize to that person based off of their needs or their EEG.
And what we find in the younger population is that is that they're missing their alpha, their nice resting rhythm, slower alpha. So we go for the alpha most all the time on the younger generation. On the older generation, my age, that are having cognitive issues, you could go for the gamma, which the gamma stimulates higher brain function and helps to slow the cognitive decline down. So, but again, we like to do the EEG first and then see.
Yeah, I will say I am very, how do I say it? What's the word I'm looking for? Discreet with how I use the 40 hertz, just because especially with like the younger population, because it can have adverse effects where it keeps people up for multiple nights since it's such a stimulating frequency. So I try to like start with 5 minutes and work my way up with that one. So if I was treating beta spindles, then I'd probably want to go for the 10 hertz just so I can do a longer time, unless the person can handle the 40 hertz. So
we did talk a little bit about your research that Alexandra's in a PhD program, and she's looking at studying some of this, kind of what the basic background is of research.
yeah, well, with the research, it shows that photobiomodulation can increase the cerebral blood flow in the brain by 30%. Another thing that I have looked through in the research is that it has been shown to increase 5-HT, which is, linked to serotonin. And so my hypothesis with that information is that red light therapy can potentially help with depression or anxiety. And so that's what I'm going to be gearing my dissertation around to see if it does that.
As a standalone.
As a standalone, we're going to see. I don't know. We'll find out. But there is some promising research out there. But I did see Matthew, you had your hand up. Do you want to pop in with a question?
Yeah, really appreciate the talk. It was great. I just had a quick question on caffeine and what effects you would notice with caffeine on these excessive beta spindles.
You're right. Good question. Caffeine increases alpha speed, and caffeine increases beta. And yes, if you already have a sleep issue, the last thing you want to be doing is jacking yourself up even more with caffeine. So moderation is great. 8 ounces in the morning is not going to hurt anybody, but people who are addicted to the caffeinated drinks, I heard something the other day that Mountain Dew was going to stop distributing. Pepsi was going to stop distributing Mountain Dew in the state of Texas.
Really?
Yeah, because of its high caffeine content.
Wow.
I thought, well, don't quote me on that, but look that up. And I'm going, oh my gosh, and Mountain Dew is one of the worst. I mean, you can really get stimulated on Mountain Dew. I had a young boy coming in, had all sorts of anxiety, couldn't sleep and everything else. And I asked his mother, I said, well, what does he drink a lot of? She said, well, he drinks Mountain Dew. I said, how much? She said, a couple bottles a day. I'm going, okay. She meant 2-liter bottles.
That like reminds me of like what that Talladega Nights quote. I'm all jacked up on Mountain Dew. That's well.
I have a question.
Sure.
But did you finish, Alexandra?
Oh yeah. You can go
Okay.
ahead.
Dr. Long, I'm wondering if you could comment on the positive feedback loop that I assume happens with the alcoholic phenotype, which is basically the EEG findings are low amplitude, fast background frequency, no resting rhythmic alpha in eyes open or eyes closed, and very little SMR. And this was identified in the Johnston, Gunkelman, and Lunt paper on EEG phenotypes as being a predisposition to alcohol use. And of course, the studies that Martijn Arns and others have done showing that if you give alcohol to individuals who have this phenotype, they start to produce alpha and they start to actually feel really well. So they have this kind of irritable background with a lot of low power, fast frequency EEG, not able to self-soothe. You give them alcohol, they get some alpha. You give them some more, they get some more alpha. And then what happens in the middle of the night is that as the alcohol is metabolized, you get this rebound of beta spindling. So the whole hangover phenomenon the next morning is this irritability, a feeling of aggression, a feeling of, you have inflammation in your brain,
right,
from the beta spindling. And I think that's what predisposes people who have this tendency to drink again. It's like, okay, when am I going to get my first drink?
Well, you're totally right, Mary. And I worked this population inpatient for quite a while before I got out of that jungle, but at least I had the God key. we find that our alcoholics mostly, and our ones that like the downers, the pot people, they are truly self-medicating. That does help give them alpha. It does slow them down. The problem is a rebound effect like you're talking about. And, we can't stay stoned and drunk all the time. So, even though that does make the brain feel better, that's not the proper way to self-medicate. And again, which came first, the chicken or the egg? We're still trying to figure that out. Did the sleep issues, the alcohol, normal 4-hour rebound that wakes them up in the middle of the night once they pass out, it easy go to sleep, but then they get up and got to have something else. Those are the cases that really are suffering with, and we know alcohol is a toxin to the brain. Alcohol is a toxin at higher levels. In the state of Texas, they consider alcohol abuse, substance abuse, a brain injury. And a brain injury then elicits spindling excessive beta. So they're all going there and they're trying to calm it down. That's not the way you do it. And when we work with people, it's how can we get them to create their own alpha, slower alpha, alpha theta training, eyes closed is excellent for training the brain, how to create its own. So let's fix the problem and not treat the symptom. And I do understand the self-medication drive behind this. So in alcohol and drug programs that we have a program. Who does Zach work for? Lunar Recovery now is doing neurofeedback, and and he's one of our people. He was at our conference, Mary, in Santa Barbara. And they're doing photobiomodulation as well, because I'm pushing that with the substance abuse population. We've got to help them feel better without their drug of choice. And the 10 hertz alpha V light to help with the inflammation, help with the reactivity, help with the sleep, really does help that part in combination with the neurofeedback to treat substance abuse. So it's all linked together. Perfect question.
Thank you.
Okay.
So JC in the comments, she asked, how long do you typically do the red light therapy prior to seeing results? And so this one, as far as results, people can feel better and notice sleep improvements just after like one or a few sessions. Whenever I do the 40 hertz on myself, I can almost immediately feel like more attentive and like focused. If I'm feeling anxious, I'll do the 10 hertz and then it'll immediately give a relief. But as far as like seeing results with beta spindles, what we typically do at our center is we will do 20 sessions and then we'll do another mini EEG. And just with those 20 sessions, we can see improvements.
Cool. Any other questions out there? This is an interesting topic. Yes.
I have questions. You just said 20 sessions for the red light. How would you kind of expand those out? Like how many sessions would there be in 1 week time?
So it really ends up depends on the person and how, hard they want to tackle this. So it is pretty difficult for people to come in 5 times a week, but we have done that but I would require at least 2 times a week. Yeah. And then with the V-Light, so at our center, we offer 2 different photobiomodulation red light therapy options. We do have the V-Light. That one is really great for wiggly kiddos. And then if we just need to do pretty simple like 10 hertz or 40 hertz, there's one that goes here, 3 in the back, and then a nose clip. So that adds some healing for, this facial area. So I do like that one. We also have one called the Cyton Bright, and it looks like a helmet that reflects the 1020 EEG placement system. And it comes with 6 diodes that we can put in any location. And so we use the EEG to help target the beta spindle. So since a lot of people do have beta spindles up in the front, I like to use the Cyton Bright over the V-Light because the V-Light only has one little light right here. So what I do with my Cyton Bright, I put all 6 diodes and I try to focus just on the parts that the skin is showing so that most of the red light can get through, but there will be some that are on the scalp line. And then I just do maybe like 10 or 12 hertz for them, and I'll use their EEG. I'm trying to get the V-Light to show y'all. Yeah. But for someone who wants to use this V-Light very frequently, It is pricey, but then, you know, it's worth the investment. You can buy one for at-home use. The Cyton Bright would not be for at-home use, but the V-Light would be at-home use. And then the Brain Center does have a code where you can get, is it 10% off?
There is a percentage off. It is discounted
Slightly,
rate.
a slightly discounted rate. And so, yeah, this one is great for at-home use because it's really, really easy. You just place it on your head like this. So then like this sends the red light here. Oops, I didn't mean to actually turn it on.
Yeah.
Oh, you turned it on. And then so yeah, then it's just like a really easy button.
Is it going? Is it flashing?
No, that's okay.
All right.
And then you would just put this nose piece up your nose. And so that's what you would do. You would wear it for 20 minutes. And then it would just turn off when it's done.
You can do anything you want with it. It's not restricted. If you want to lay in bed and use it or anything.
Yeah, it's pretty convenient to walk around with. The Cyton Bright, you're going to be stuck to your couch, or our couch. But yeah, it's really exciting to see the upcoming like research that's coming out about photobiomodulation and how it helps. So Matthew said, do these results need constant maintenance with red light therapy, or are they persistent for a significant period following? You know, I'm going to be honest, I'm still looking for the research out there. I just don't think it's been done enough for people to know. Like with the neurofeedback, there have been research, like results showing that it's permanent, but with the V-Light, I would see it more of a maintenance.
Well, what also, when you think about it, antibiotics. Will one course of antibiotics cure you for the rest of your life? No. As you get another injury, as you get another some sort of infection or some sort of COVID, or you get traumatized, it's again, you have to go and retreat because it's more treating the inflammation. It's not reprogramming the brain.
And it's like it's really great for improving just your brain health. And so that's why it would be so nice to just have one at home. I really do think, I don't know if we'll see it while I'm alive, but I think like one day it's going to be like phones. Everyone's going to have red light therapy in their house, and it's just going to be a norm for everyone. I could totally see that happening.
And one of our colleagues up in Dallas, she's been using it for years and combining it with neurofeedback. And we find that the neurofeedback is much more efficient if we do the red light therapy first and do the neurofeedback second. So in our brain injury cases, this just become our standard practice.
Yeah, we have options where people can either do like a expedited 10-minute session before their neurofeedback, unless they want the full 20, then we'll do that too. But those are our options we provide here at the Brain Center.
So we have one here in office, the V-Light, but you say you would recommend it be something that's done before the neurofeedback session.
Yeah, we are pretty flexible with it. You know, if the device is being used by someone else, we'll do it after. If the person, we cater it to the person's needs. There have been some cases where people prefer to wait till after, but most of the time, like my go-to would be using it before, because I see it as you're putting your brain cells in a learning state. You're giving them energy. So then they're going to perform better during the neurofeedback and potentially be able to get more out of the neurofeedback session.
And let's talk just briefly a little bit more. I got a great YouTube video from a professor the other day, and was talking about the mitochondria being the powerhouse of the brain. And when we think about that, the mitochondria is supported by the thyroid, but the mitochondria also, we had a case the other day where I had a 10-year-old boy come in on December 12th, 22 days later, he came back and did another EEG. Won't go into all the reasons why, but in that 22 days, his power that's coming out of his brain, we measure by the amplitude of the alpha, was cut in half. You'll like this case, Mary, was reduced in half, and his frequency of his alpha was slowed by by almost a cycle a second. This is something seriously going on inside this person's brain. And so his neurologist, Dr. Feasel, with Dr. Melissa Jones, she's going to do some testing to look for heavy metals, to look for insecticides, pesticides, and look for toxins, because if we look at the brain's health and we see a reduction or see a low voltage, and it's not your traditional low voltage fast like Mary brought up, then there's got to be low voltage slow. If you the definition of encephalopathy is a low voltage slow EEG. It's got to have you got to have a neurologist call it though, but it's because the mitochondria is losing its ability to power up the brain. And I think they're really closely tied together. So that this mitochondria health, what the V light does is actually penetrates all the way down to the mitochondria and stimulates the release of nitrous oxide. Now, nitrous oxide is what helps our brains basically attack the reactive oxygen species, the oxidative stress, and reestablish our sleep, because when we take our trash out of our brain at night, it's at night during the delta stage of sleep. So I think a lot of people, why they have the brain fog is because they got a trash backup in their brain. They're not getting it all expunged out. Does that sound logical, Mary? I know you're the one probably.
Yeah, and it's also possible that kid is getting really poor quality sleep. I mean, it could be toxic, metabolic, anoxic, or traumatic, but if you put really poor quality sleep, if you overlay that on top of it, and you see slow,
Right.
you see really, really slow frequency, and if it, if you're getting higher amplitudes, that's gonna look like a sleep deprivation problem. So I like the fact that you referred that person to a physician who could do some assessments in order to try to figure out what's going on there.
And I kind of looked at sleep and we checked it, and he has never slept well, but it's just so odd that in 3 weeks we could drop half his microvoltage and then, slow his brain down a cycle a second when it's not supposed to do that at that age. So there's something ill going on with this child. And it's a neurology case. It's out of our hands then. We've got to know when we just punt on those cases and say, there's something else going on. We need somebody to chase this down. So I'll let you know what happens on that case. Just an interesting case.
I gotta go, Ron, I'm
Okay.
sorry.
Yeah,
Thanks
we
for the
probably
great
need to wrap up
conversation.
too. Thank you so much for coming.
Thank
Take
you.
care.
Bye-bye.
Bye-bye.
Any other questions out there? Jeff, I see you there. You showed up a little late, but glad to see you, buddy. Jeff was in my cohort in grad school in 1995 through 97. So you got any questions, Jeff? Nope. Okay. You can see we got matching diplomas right behind us.
Look at y'all.
know.
That's awesome. Thanks for joining.
Hi guys, I guess we want to close it for today. Thank you
Yeah.
for everything. We'll kill the recording wherever it is.
I know.